A new clinic will be opened this morning in Cathyville in Barberton in Mpumalanga. The clinic has been built by a local mine in partnership with the Department of Mineral Resources. Let's bring in our man on the ground, Tumelo Machogo. He's live for us there. Tumelo, very good morning to you. Tell us more about this clinic and the difference it will make for that community.
Well, Blaine, good morning, and good morning to our viewers. This clinic actually will be a good help to this community because Barberton itself, especially in the townships, they have not had a lot of clinics. They only have one clinic. So this clinic would actually cover between Extension 1 and Extension 8, which is a huge ground for covering people. So they will cover those grounds, making sure that a lot of people also are being are coming here for health purposes, to come here to take their medication, also to come here and to do testing, especially COVID-19 testing. We know so far that the Barberton mine has spent about 15 million rand just building this clinic here in this extension. Also, this is the second clinic that they have built so far in this community. Other one they have built in the rural part of Barberton, but this one would cater for at least eight extensions here in Barberton. So it's a huge difference that it will bring to this community, because some people had to travel distances to get to access healthcare services. You know, they have to go to town to go to a clinic or to go to a hospital, but this clinic would be of a great deal to them, because not only is it going to help the community here, but across the sections that are in here, and also those people that are most of the time traveling to town and they can't access healthcare there, they were able to come here because it's a huge clinic. It's also one of the state-of-the-art clinic. They have a huge building here just behind me, and also the Minister of Mineral Resources, Gwede Mantashe, the Premier, Refilwe Mtsweni-Tsipane, and also the MEC of Health. They are expected to come here and open the clinic any moment now. They are expected to arrive and open this clinic. But Blaine is going to be a huge help to this community.
All right, talk to us about its impact in terms of the fight against COVID-19 as well. Is there talk that this new clinic has been earmarked as maybe a vaccination site? I'm looking at your numbers in Mpumalanga, 899 new cases at last count. You got a total of 134,143 in terms of total cases. Talk to us about that difference it will make in the fight against COVID-19.
Well, indeed, Blaine, it will make a huge difference, because so far they have not started vaccinating people here, but we know that they are screening people here. They are testing for COVID-19. Lungile and I, my colleague Lungile Ngwangwana, who's on camera, we were actually going inside the clinic just to monitor what's going on in the clinic, but also we saw that the clinic will also come of help within the community, especially when it comes to COVID-19 testing and here in this community, because the people have to travel long distances actually to go to town to test for COVID-19. But this is going to be a huge help to them. I see that the minister has just arrived, Blaine, but also we'll try and speak quickly to the management of the Barberton mine. Mr. Martin, thank you so much for joining me. If you can just stand this side. Mr. Martin, just talk to us about this initiative that you guys have started here with this clinic. I know it's the second clinic that you guys have built so far. Just talk to us about what is this clinic going to do to help this community, especially here, because we know there's never been a clinic in this extension, and Barberton is growing every single day.
Yeah. All right, good morning. This clinic was actually one of Barberton Mine's SLP projects. So it was initiated in 2014, 2015 already. That's when we identified the serious need, and we identified that there's at least 17,000 people that are in this area that had to travel continuously into the one clinic that was in Cathyville. So that's when we saw the need, and we realized that the need for a clinic was here.
And also talk to me, I know you guys have spent about 15 million, and just talk to us about and also it's one of the best clinics. It's a state-of-the-art clinic. We saw a lot of machines inside. We don't know how those machines are working, but just explain to us how did you guys get involved with this thing, and how much money have you guys spent so far, and are you guys willing to spend more to build more clinics in this area? Because yes, one clinic is going to mitigate a lot of issues, but it's not good enough, so we need more clinic. Are you guys going to build more clinic?
Yeah, you see, the need within our country is enormous, specifically when it comes to the basic health care. This clinic is costing us 15.3 million. And yes, it was a partnership between Barberton Mines and then ultimately the Department of Health. So we basically as a mine took care of the external in terms of the structure of the building. The Department of Health is supplying the employees and supplying some of the furniture that you have observed on the inside as well. Now, I know that as a company, we go through every 5-year cycle where we draw up a new SLP, and there is a strong possibility that a clinic like this would be on the cards, but that is entirely dependent on what our consultation with the community then delivers. It might not be in this particular area if there is a clinic like this, but we're going to have to see what the next 5 years holds for us.
Okay, thank you so much for speaking to us. I know you guys are very busy. Blaine, there you have it. This is the manager of Barberton Mines here in Barberton. He's Mr. Martins, talking to us about the clinic here that has been built here. It's the second clinic that they have built so far in this in Barberton alone. They built one clinic in rural part of Barberton in Munjindini, and now this is the second clinic that they have built so far. The unveiling is currently underway there, Blaine, so we're going to have to hand it over to you so that we can go back to the clinic and take shots of the minister and also the other dignitaries that have arrived here.
All right, Tumelo, thank you very much indeed for your reporting.